हेलो एवरीबॉडी, आई एम डॉक्टर विशेष। और ये जो पूरा महीना चल रहा है मई का, दिस इज़ मेंटल हेल्थ अवेयरनेस मंथ। ओके, और आज का दिन भी देखो, आज मदर्स डे है, तो हैप्पी मदर्स डे टू एवरी मदर आउट देयर। और ये एक बहुत मदर डे भी और मेंटल हेल्थ मंथ भी, तो ये दोनों को मिलाकर आज एक बहुत सही दिन मुझे लग रहा है। तो आज मैं और मेरा एक दोस्त, पुराना दोस्त, हम लोग साथ में नीट की तैयारी किया करते थे, तो हम लोग दोनों ने मिलकर एक पॉडकास्ट सॉर्ट ऑफ कुछ क्रिएट किया है। तो आप लोग देखो और बताओ कैसा लगता है।
Hi everyone. So, welcome to today's video, a conversation that matters, a dialogue that could change lives. Mental health is not just a topic, it's a reality that affects us all. In a world filled with constant hustle, stress, and pressure, taking care of our mind is just as important as taking care of our body. So, as we know that May is the Mental Health Awareness Month, so I have invited one of my friend, and he's a doctor, MBBS, Dr. Vishesh Vijay from Rama Medical College, Kanpur, and he's practicing. He works in the patient care. So, hello Vishesh, how are you?
Hello, Adnan, and hello, everyone. I'm Dr. Vishesh, and on this month, we are trying to spread some mental health awareness. So it's a very good initiative by Adnan, and I'm really grateful to work with him.
Okay, so let us start with some good questions that can be very helpful for all of us. So, what is mental health and why it is important?
Okay, so mental health in definition, we can say that mental health means emotional, psychological, and social well-being. But in practical terms, I would say that it means how well you can manage your emotions, your thoughts, and your behavior in daily life. It's about emotional stability, like handling stress, handling anger, solving problem without getting overwhelmed. It's about coping skills, coping and adaptability to your work pressure, study pressure, loss. Like right now, NEET 2025 occurred, and it was like questions were very tough, so coping with all this kind of stuff, all this comes under mental health.
Wow, that's really very nice. And yeah, what are common signs and symptoms of mental health issues?
So common sign and symptoms of mental health issue would be persistent sadness, low mood, excessive worry or anxiety. Like people with same problems, they are like okay and chill, but you are having more anxiety, you are more worried. Then having irritability, even on small steps, you are becoming so much irritated and anger. Mood swings could be there. Loss of interest in activities like party or any activity, be it games, party, or social media, watching movie. There would be loss of interest. There would be difficulty in concentrating, be it your work or your education. There would be change in appetite. Um, there are several people who don't feel hunger when they are stressed, which causes weight loss. And there are other people also who eat more when they are stressed, so that causes overweight.
Okay,
Sleep
okay,
issues would
okay.
be there. Sleep issues also occur. Like in some patient, insomnia is seen. Patient is going to sleep at 10 o'clock or 11 o'clock at night, and he is in bed, and it's been now 3 o'clock or 4 o'clock in the morning, and he's still not able to sleep. Or other group of patient, they do oversleeping. Then other common symptom is social withdrawal. uh, the person with the mental health issue is not actually interested in having communication with anyone. He pull him or herself away from the social gatherings. And very much serious thought of self harm or suicide could also be there, symptom of mental health issues.
Okay, that's really amazing. Uh, so, how can stress, anxiety, or depression affect physical health?
Okay, so one thing you might have heard, that in a healthy mind resides a healthy body, and vice versa is also equally true. A healthy mind can have a healthy body only. So how it works, like if you are stressed or if you are having any mental health issues, your immune system weakens. Okay, so first your immune system weakens, then there is a cortisol level surge during your stress time. Now this causes your increased heart rate and your increased blood pressure. This also disrupts your sleep. In some patient, it is also seen that due to stress, a stress ulcer in their stomach is formed. And IBS also occur. Irritable bowel syndrome means when the patient with a mental issue, when they were feed something, they feel abdominal cramp, abdominal pain, and often followed by diarrhea or loose motion, this type of stuff. So this is how you can say that how physical health is also linked to mental health.
Yeah,
In fact,
that's
in some
really
patients, this is also seen. In some patients, this is also seen that when they panic, an asthmatic attack occurs to them. They are unable to breathe. In extreme cases, this thing occurs in extreme cases.
yeah,
So this
yeah,
is also point.
that's really true. So, what are the major causes of poor mental health in today's world, and how it can impact in their daily life?
One of the common problem: high work, heavy work pressure, academic pressure, then financial stress. Then comes your social media, very much common nowadays. You work on your social media, you begins to compare yourself with others. So comparison on social media. Then there could be some history of trauma or abuse in your past that also affect your mental health. Poor lifestyle, very much important, like inadequate sleep, unhealthy diet. So these are all more or less. Or one more important thing, like pandemics. We recently have faced COVID-19. It also created a lot of panic, mass hysteria, which we call. So pandemics can cause mental health issues. Then war, currently Indo-Pak war is going on. This also create a very much panic, mass hysteria, especially in Pakistan. I've seen reports where in Pakistan a mass hysteria is occurring. The complete population of Pakistan is in panic right now. So this kind of things. This is how mental health problem causes. This is what it is.
Yeah, I truly agree with you. And one of the main important thing that I came across, like what you told during, what you told during comparison, like comparison. People are comparison. They are doing
Mhm.
comparison on social media that how other people are happy and how their lifestyle is very good and all these things. So comparison kills creativity. So I just came across this thought in my mind that comparison kills creativity. So
Yes.
yeah, so exactly what I agree with you. And of course, there are many lot of things. That affects in their lifestyle modifications when the people is suffering from the mental health issues. Okay,
Mhm.
so my next question is, what is the difference between feeling low and having a mental health disorders?
Okay, so feeling low is normal. It is very much natural, and it is very much important for your growth also. So feeling low is basically it is temporary and it is event triggered. There is some important event, be it your loss at your work or maybe breakup. So it is event triggered and it resolves with time and support. But when it comes to a mental health disorder, this is persistent, intense symptoms which last for weeks to months or sometimes years. And this mental health disorders is actually affect your daily life. It affects your work. It affects your relationship. And so this is the basic difference. Feeling low is normal. Everybody feels low, and it is important also. But if you are feeling a persistent, intense symptoms for months or years, then it is mental health status problem.
Yeah, this is the amazing answer. So like what I have noticed nowadays, like people, like they avoid seeking mental health problem by like consulting a physician or doctor. Like nowadays what is happening that when they consult to their physician regarding their mental health or any psychiatrist, so they have been like having an embarrassment moment when they discuss with some people, some friends. They are when they are talking, when they are openly talking with their families or friends. So my next question is, why do many people avoid seeking help for mental health problem?
Okay, yes, it is very much common that people don't seek mental health, and there are major 3 or 4 points that why they don't seek for help. First one, very important one, is the stigma. They think that if I go for seeking my mental health issues, help for my mental health issues, then people will say that he's a weak person. So stigma comes there, a shamefulness, a feeling of weakness. Other thing is that lack of awareness is also there. That patient is not actually able to know that this is a disease, this is a problem for which you have to go to the doctor. And other very important thing is denial. Person with a mental status, with a mental disorder, they're actually in denial that I'm having. They think that I am a very normal person. So this denial thing is also there. So this is basic 3 points that why they are not seeking for mental health.
Yeah, that is really true. So when should someone consider seeing doctor about their mental health? Like when should they consult to the physician or any family doctors uh, for their mental health issues?
So very simple to understand when one should go for help. First, if the symptom is persisting for weeks or months, and if the intensity is so much that it interferes with the work, relationship, or daily task, or if there is some severe signs like suicidal thoughts, panic attacks, inability to function, in all these conditions, definitely go to the healthcare professional.
Yeah, I truly agree with you. So can an MBBS doctor help with mental health issue, or should one only see a psychiatrist or any like specialist? So what are your views and points in this?
Okay, so an MBBS doctor can assess and manage mild issues, like giving some basic pills which can relieve your stress a bit. But if you are having anything serious, if you feel like my issues is more, then definitely go to a psychiatrist, because psychiatrists are trained in a way that they can counsel you very well. Because medication is not the only thing which you will need to cope up with the problem, with this mental health issue. Psychiatrists are very well trained in how to talk to the patient, how to motivate them, and they are actually they can very well relate with the patient, with the problem of the patient. So it is always advised to go to a psychiatrist. If you're having a very mild symptoms, then you can go for an MBBS doctor too.
Yeah, that's really very impressive answer. So, what are your some tips, or what you can give any suggestion to ease this mental health problem, and how healthy habits can help in good mental health? And what do you suggest on this? What are your points?
Okay, so for maintaining a good mental health, the point remains the same, which we have been told by our parents. take proper sleep, 7 to 8 hours sleep. Okay, exercise regularly. If you don't have time for exercise, at least exercise 15-30 minutes. Go for walk. Walking is a very good treatment to decrease your cortisol level. Then eat a balanced diet. Eat fruits, vegetable, whole grains. Stay hydrated. Always stay hydrated. Drink 2 liters of water at least daily. Then maintain social connection with your family and friends. And if you have time, always do for mindfulness or meditation. Meditation is definitely a great thing for this. Decrease your screen time, social media comparison. Don't do these things. And very important that if you have some hobby, give your time to your hobby, because once you start doing things in which you feel pleasure, all mental stress that just fade away.
Yeah, that's really nice answer. Jesh, my one question, there are two questions so left for this video. So my one question is like people are, like having dependence, having the belief that by drug abuse or alcohol can be the replacement for mental health relief and mental relief they get. Likewise, this is the belief of the students or any people by smoking cigarette or anything that can be, like done on a temporary basis, and they think that this can be the relief of their mental health.
Yes, so this is totally absurd. Consuming alcohol or doing drugs, it may provide a temporary relief, a temporary sense of relief, but in a long go, it will actually worsen your mental condition over time. Okay, it increases the dependency and addiction whenever you are going to meet with the same problem, because it is a life and always there will be problem challenges coming in your life. So now the next time again when you see such a problem, you will again go for drugs. You will again do drugs, alcohol. So this created dependency and later addiction. Moreover, doing drugs and alcohol, it impairs your judgment and complicate the recovery, the mental status, the mental stress that you're feeling. It will also complicate the recovery of your status. So this is totally ridiculous. This is a totally ridiculous belief that alcohol can help you to get rid of your mental health issues.
Yeah. So, Dr. Vishesh, what message would like to give people struggling with the mental health issues?
Okay, so message from my side would be: you are not alone. Help is present out there. You just have to seek help. Spend time with your family, with your loved ones, and stay strong. Believe in yourself. Time changes. This time will also pass.
Yeah. So I would like to, end up this session, and would like to make some more videos together for collaborative videos, and stay tuned
Yes,
and do subscribe to our channel and stay tuned.
yes.